Joining us now is our chief medical correspondent, Dr. Sanjay Gupta. His work on the CNN documentary on medical marijuana has caused him to change his own mind about the benefits. Sanjay, so what's your reaction to Governor Christie's decision?
Well, I think, he has eased some of these laws, and making it more possible, I think, for kids, including Vivian, Brian Wilson's daughter, to get the therapy that could help her. I think that there was a couple of issues that came up. First of all, many of these dispensaries were only allowing 3 strains of marijuana in the past, and that was concerning because some of the strains that could be most helpful are actually strains that are high in CBD, the more medicinal part of marijuana, and low in THC. And that's something that could certainly help Vivian. The other thing was, obviously, this is a medicine that, for Vivian, for example, she would not be smoking this, but rather taking it as an edible, so turning it into an oil or tincture, that could also be quite beneficial as well. I think Brian Wilson has concerns, as you just heard there, about the fact that, you need to have your prescribing doctor, a pediatrician, as well as a psychiatrist to both authorize the prescription. That is how it is in other states as well. So I think he found that a bit onerous, but it's a pretty common practice, and I think ultimately Vivian should hopefully be able to get the treatment that could help her.
Well, let me just quickly be blunt. If this little 2-year-old girl, if she were to get this medical marijuana, Sanjay, would those seizures stop?
I think there's a very good chance, Wolf. Look, I think the one thing everyone agrees on is we need more study. But let me tell you, I met a girl with almost the exact same situation, something known as Dravet syndrome. It's a girl that was having 300 seizures a week. She's now down to 3 or 4 a month because of medical marijuana. And keep in mind, she was on lots of different anti-seizure medications, 7 of them at one time, and none of them really worked for her. If you look at about 41 kids now around the nation with Dravet's, all of them have had some improvement with medicinal marijuana. Several of them, or a majority of them, I would say, have been able to get off all of their other medications. So I think from that standpoint, the odds are on Vivian's side. And keep in mind, for years, even 100 years ago, we knew that medicinal marijuana could have an impact on convulsive disorders, the very thing that Vivian and Charlotte have.
Sanjay, in your new documentary, Weed, you went to Israel. You got a firsthand look at how Israeli medical experts were dealing with medical marijuana. They're on the front lines of this issue. Let me play a little clip from your documentary.
This is Israel's largest hospital, Sheba Medical Center.
You put up your medical cannabis.
Amashe is using marijuana to help him with the pain and nausea from chemotherapy.
Filling up the spoon, so that's your medicine inside there.
Of course. Now take it out, put up the valve.
And he's doing it inside the hospital.
How are you feeling?
Relief, first of all, in the muscle, in the leg.
And you're not worried about any potential damage to your body?
Not at all. The opposite, actually. I really believe I can be cancer-free for a long time if I continue, consume cannabis.
Yes, he said cancer-free. Very early studies on mice in Israel, Spain, and the United States are now showing the potential of marijuana to kill cancer cells. It's exciting research, but it is still in its infancy, and it's inconclusive. This program at Sheba is well established, and experts say a teaching tool for using marijuana in other hospitals.
Sanjay, do you foresee U.S. hospitals, American doctors using medical marijuana in that way anytime soon?
It's so hard to say, Wolf. I mean, I think that, earlier I mentioned that I think this is an area that both sides agree on, the need for more research. But it's difficult to get research studies approved the way things stand right now, Wolf. In addition to getting, if it's a cancer study, for example, getting the National Cancer Institute to approve it, in order to get the substrate, or in this case, the marijuana for the study, the National Institute on Drug Abuse has to allow that to happen. And remember, this is the National Institute on Drug Abuse. Their mission is to study drug abuse. Their mission is not to study the potential benefits of drugs, including marijuana. So I would like to see more research done. I think again, everyone agrees on that. But I think part of the structure of how this all works is going to have to change in order for that to happen.
Sanjay, thanks very much. Thanks for your excellent work on this subject. And I want to just point out to our viewers, Dr. Gupta's excellent documentary, Weed, will re-air tonight, 10 p.m. Eastern, right here on CNN. If you didn't see it, watch it. And if you actually saw it, you may want to watch it a second time.